I thought I did a fabulous job, but then some workers scolded me, And why this project is so successful? Because it didn't come from the top, it's actually bottoms up.
Have you had an encounter with someone that really left a mark or an impression on yourself?
It's actually a very simple incident.
Welcome to Working the Ground, a podcast where we talk about issues and, more importantly, the stories behind the labour movement. Today, we have Stephen. Stephen, would you like to do a very quick introduction on yourself?
Hello, hi, I'm Stephen Goh. I'm actually the Executive Secretary for the Healthcare Services Employees Union.
To clarify, HSEU is Healthcare
Services
Employees Union. Yeah, okay.
Employees with a apostrophe.
Oh, okay. The apostrophe must be there.
Yes.
Okay. You have been in the HSEU for a couple of years.
The last 4 years to be exact.
Last 4 years. In your experience, what are the healthcare workers struggling with, or what are some of the challenges that they are facing with right now?
Other than the usuals that you probably have saw it on the social medias and all that, shortage of manpower crunch,
For sure.
heavy workloads. It's very expensive, right? It's very expensive to get a senior nurse manager or nurse manager to actually do the very mundane job. If we can actually adopt technology, and we're not even talking about high tech. Here we're just talking about maybe barcoding, but the barcoding must be integrated with the back-end systems. Actually, it frees up the time. So today, if you walk to this hospital that I talk about, the nurses are no longer doing their mundane job. So therefore, they have a lot more time to do patient fronting kind of job. And why is this important is because then they have better job satisfaction, because when they actually subscribe to be a nurse, that's what they want to do. And you give them that job satisfaction, which will then translate into better staff retention as well. Got it. So it's a win-win-win. And why this project is so successful? Because it didn't come from the top. It's actually bottoms up.
Right.
The nurses approach NTUC and HSE and say, I don't want to do this job anymore. Can you help me to take away this piece of the mundane job?
Right. Got it. That's a very good sharing. And I wanted to ask you, because you talked about technology, right?
Yes.
The whole world is talking about AI right now.
Absolutely.
And
annual increment?
Annual increment. I think that one is everyone like one. But we also have to come to terms with AI, which is artificial intelligence. Right. Everyone is talking about it. And I also understand that perhaps healthcare is one of the industries that's impacted quite a bit by AI.
Absolutely.
So in your perspective, is that true? And what are we doing to help?
Yeah, certainly. I think the potential for the healthcare to adopt technology and the AI is certainly there. In fact, when we actually start promoting CTC some 2.5 years ago, I think we already see a lot of potential.
Right.
So for example, the project that we did in one of the hospitals, we actually embedded AI into the smart scheduling. So that it actually have the ability to predict some of the planned as well as the unplanned absences, and therefore able to plan out the required workforce for the day with the right competency for that day of the time, and for the time of the day as well.
So they can predict. They
can predict based on the past
that's real
precedences as well. So it's really quite intelligent.
Got it.
And currently the company is actually really looking into that with one of the tech provider.
Wow. Okay. I just can't imagine how impactful AI will be in the next 10 years, especially for the healthcare industry. I can't, because AI just moves so fast, right?
That's right.
In a couple of months, you have a new thing already, and then
that's right.
They release something again, then release something again.
That's right. Right. So it's not just in the clinical space, but also in the non-clinical space as well, the administrations, the operations.
Definitely.
There are so many projects that currently we are doing it as well.
The last I read, HSEU has about 50,000.
We just passed 51,000.
Do you have a number on the wall somewhere that you can track?
It probably is hover around 150,000 to 200,000.
Can I also ask, I also saw that in February this year, there was a pay increment for a whole bunch of community care workers. I shouldn't say whole bunch, because it's 23,000 of them, which is a lot.
Yes.
I would assume that it was also a very tedious process, to help to push for this.
Yeah. So you're absolutely right about that. There's a lot of efforts and a lot of deliberation being put into it. In fact, if you trace back over the last 3 years, right, Chinese New Year, on the first day itself, there are always good news announced by Minong.
Wow. Oh, yeah. Actually, I think
and it didn't come by chance.
I see.
So a lot of efforts from the union in lobbying the ministry for it as well. And because of the unique relationship that we have with the minister, we actually have a very intimate sessions with him every year.
Oh.
We have a dialogue,
like
a 2 hours dialogue with him.
himself.
Yes, and of course he will actually bring an entourage of people to support him as well.
Okay,
and that will include the 3 clusters and the AIC and the lot as well.
Got it.
And in this 2 hours intimate session, and that's when we actually put in our wish list. We will also share with him what are some of the sentiments from the ground, and what are some of the things that we hope that he can help us with as well.
Got it.
Because we always believe that we don't work unilaterally, and the best results can be yield through the tripartite partners coming together.
Got it. Yeah, thanks for sharing. I get the feeling that there are so many things that you can share about. I just don't have enough questions to ask you, and then our time will run out, right? But I wanted to find out, I mean, you have so many years under your belt. Have you had an instance or, like an encounter with someone that really left a mark or an impression on yourself, like, that night you cannot sleep, man, or like...
Actually, till today, I still use that as one of the best memory I ever have. It's actually a very simple incident. I remember I was a rookie IRO. So my first union is actually a manufacturing union.
Okay.
So manufacturing employees, they work round the clock.
Yep.
3 shift, right? So you have shift like 7 to 3, 3 to 11, and 11 to 7 again. So I was doing the night shift, membership recruitment.
Oh, wow.
So I went to the premise. I believe it was during their break time, so it was very past midnight.
Okay.
So I was busy filling up the forms for the employees who joined us. And then at the corner of my eye, I saw this Indian lady that comes to my table quietly, and without saying a word, he just left a KitKat on the table.
Have a break.
And then have a break, exactly.
Sorry, yeah.
And then she walked off without saying a single word.
Right.
But I was so touched even today when I say it now, because she actually sees me.
Yeah.
Right? She doesn't know me, but she sees me working.
Okay.
And she shows her appreciation by just simply, hey, better take care of yourself as well, have a break, don't keep signing up the forms. And she appreciated me by just leaving that KitKat.
Okay.
It's amazing.
Sometimes these small things, really leave the biggest impression on it.
Absolutely.
So the lady doesn't know that you are very touched by this?
Yeah.
Okay.
Yeah. Because she also don't wait for my thank you, right? She just show her appreciation, and then she goes off quietly as well.
It must have left a deep impression on you, for you to still remember.
I mean,
after
the
so
very
long.
simple gesture like that, and actually probably that's the thing that keeps me going for the last 23 years.
Wow.
Very simple things. Otherwise, it's very hard to sustain, right?
Yeah, I know.
Over the period of so long as well.
Yeah.
If I may share another example that leaves a very deep impression on me was when I was again the rookie IRO at the manufacturing union itself. I was handling this very huge manufacturing company itself. So they have the back end assembly, and they also have the front end wafer fabrication as well. And being always very talkative, right? I always walk into the HR of both sides to actually lim kopi lah.
Okay.
And then over kopi, we'll share how's the situation over there. And interestingly, when I actually talked to Jessica was the HR director for the back end, she was sharing with me that the company wasn't doing very well.
Okay.
Because of the global trend, and they are trying to phase out the assembly in Singapore. And then when I went over to the other side, the HR director told me, hey, I hear I'm actually at the front end. I need a lot of people. And I need a lot of people. Can you help me to find the people? Then in my mind I was thinking, you're from the same company, you all don't talk, man. Front end, back end, So if you need people, then why don't you reskill the people from the back end? No brainer, right? You reskill them since you already know your company culture and do the front end job.
Okay.
Yeah, but then of course there are some challenges. Front end make use of sophisticated wafer fabrication kind of machines. And the profile, if you look across the two companies, the profile for the back-end assembly is the mostly locals,
Okay.
senior, quite close to retirement. Whereas this group are young, multinational.
Right.
So the
right.
common language that they speak is English.
English. Yeah. So,
Design.
so you're the guy who managed to make both sides talk and then broker or coordinate.
That's why I
like,
say kopi, having meals, having makan, very important because that's when you actually discover the opportunities.
Yeah.
Yeah. So why I feel that this leaves me a very impression because first of all, it actually maintains your employability. To me, having a job is the best welfare. Yeah. Then of course, it also but of course, I thought I did a fabulous job. But then some workers scolded me,
Oh, what? You're just doing your job. Why school you
Say,
for what?
why you go and propose this? Otherwise, I'll get my retrenchment benefits.
Shit.
Right, then I can go chanting. Yeah.
Okay.
So I can't
but-
please everybody.
Yeah,
But I think if you look at the big picture, I think if you can actually save the majority, I don't know the situation for everybody, but I believe some people need the job. Yeah.
I think it's the right move. I mean, considering what you shared with us.
Right.
So you have had so many years under your belt, right? Is there something looking forward, right? Is there something that you are excited about, on your work and that's coming up?
You mean for the union?
Yep, for the actually maybe even beyond the union. But if it's for union, then also can.
For the healthcare professional community, as we speak, we already have amassed about 12 different professions. The latest being the pharmacists. We deep dive into the healthcare. There are so many different professions, right?
Yep.
So for these 12 professions that we have identified, we are going to deep dive, and then we're going to see what are the pain points. Then together with the domain players there, then we can brainstorm, and then see how we can actually break some of these barriers, and then be their advocate to push for some of this
I see.
Career advancement,
I see.
and so on and so forth.
So it's good because you have a community of many different healthcare professions coming together to share their opinions. So there's more variety in ideas.
That's right. And also allow us to deep dive into each of the profession and find out exactly what are some of their challenges, and we can overcome it together, and then uplift some of especially those in the lower of the entire value chain, how we can actually uplift some of these jobs.
Right. Thank you for sharing all they've gone through. I really think that you are someone who has been on the ground, talked to so many people and seen all these things.
Right.
And I'm sure that you have a lot more to share actually. Just that my questions are limited. The time is limited also. I have one last question for you.
Yes.
If you could swap jobs with someone for one day,
Right.
who and what would it be?
Well, first and foremost, I actually joined NTUC as a mid-career.
Okay.
So actually my first love is buildings.
Buildings.
Yeah, I've been a structural engineer for a decade before I joined NTUC.
Okay.
So I kind of miss it. I really love old buildings, the architectural and all that as well. I started off in an architect firm.
Right.
So if given a chance,
Yeah.
my first, I'd like to get back to that job, which I kind of miss as well.
Right.
So that's the first. I also love going to the museum. Yeah, so maybe I can be a museum guide as well.
Okay. So the first 8 hours you are and the next 8 hours, you just don't need to stay for that day.
How I wish.
Yeah. Right. Thank you, Stephen. It was a
Thank you,
joy
Shane.
talking to you.
Yeah, thanks so much for this opportunity.
Thank you. Thank you for tuning in to Working the Ground. Thank you, Steve, for all your sharing. And I think that's, like what I said, there's really a lot of experience that you have. If possible, maybe we can bring you in for another round again. Yeah, we shall see. Thank you for tuning in, and we'll catch you in the next episode.